I joined the Fagan program because I was really interested in using the time that we get during our third year to intentionally develop leadership skills and really think about the person and the leader that I was becoming throughout the journey of becoming a physician. And I feel like I've had a wonderful experience, and it's been invaluable to do that intentional reflection and formation, not just myself, but within a community of people that are also interested in doing the same thing. It's been a wonderful experience, and I'm really grateful for it.
I felt like being a part of Fagan would allow me to meet other people who are in different spaces in the medical field and in different parts of training that I could learn from to help me develop who I am and what kind of leader that I want to be.
If I knew that I was going to have a dynamic and vibrant relationship with my executive coach now, before I had started the program, I would have been way more proactive early on, scheduling meetings, working with them to work on some of the hardest issues that I'm personally dealing with professionally. And there's no question that the relationship I've developed now is going to keep growing in that regard.
The outstanding interactions that I've had with the people in the program, for me, have been probably, other than the actual didactic leadership and education training, I think that my experience meeting my teammates, meeting the rest of the Fagan scholars, and getting to learn from them, find out about them as people, and really see what an outstanding group of people they are, I think only further exemplifies the strength of the eventual Fagan alumni network that has a cadre of accomplished, leadership-minded and community engagement-minded people that are really working to make not only the health profession better, but also, their community at large better. And I think that's something that I've really enjoyed this year.
So one of my favorite things about the Fagan Leadership Program is the collaboration that happens amongst cohorts. So our team, for example, is filled with medical students, residents, and fellows. And for our project about leadership development within medical education, it's nice to have people with various perspectives and on a different stage of the medical journey. And that kind of helps us when it comes to actually implementing changes for the medical school curriculum. Also, what I love about the Fagan program is it provides us specific time in all of our busy days to reflect, be mindful, and just take a pause and think about the progress we've made and how we can continue to make progress in the future in a sustainable way.
For our project, we tried to reflect the experience we had at Fagan for other medical students. In our program, we had a diverse set of students, residents, and fellows who all had to work with different time constraints to make this project come to life. Similarly, we believe that students have similar issues in medical school, and hopefully this program can give them a curriculum by which to focus their medical school education around the central tenet of leadership.
One of the things that we've been working on in our group has been to try to consider ways that we can help improve undergraduate medical education, specifically with a leadership-minded focus. To that end, we've had some outstanding medical student involvement from Megan, Allison, and Imoh, who really helped to pioneer our work with the pre-existing primary care leadership track here at Duke for the medical students. And that's a track that medical students that are very interested in primary care, but also in community engagement and public health, and the ways in which they can integrate and synergize their clinical practice with the types of leadership that is important from a primary care setting, both in the hospital and the community. And our goal for this year has really been to come up with ways that we as Fagan scholars can help implement some of the things that we've learned into that curriculum with the help of the faculty mentors and the hospital at large.
My name is Fatima Sayed. I'm the director of the Primary Care Leadership Track, and the mission of PCLT is to create change agents for healthcare. Primary care is sort of the gatekeeper and one of the most important roles in the healthcare system, and our goal is to support Duke students to feel grounded in that profession, and not only to be clinically primary care physicians, but also to be leaders in the medical field. So we hope to graduate physician leaders and change agents for the future. Basically, PCLT is a pretty small group of people. It's about 8 students each year, and The L in PCLT is leadership, and so we have offered mentorship to our students. But what's really nice about the program that Allison and her partners have created, and Allison is an upcoming graduate of PCLT, is that basically it aligns really well with the structure of PCLT to talk about the real specifics around leadership and leadership development. So what it'll look like basically is from MS1 through the end of MS2 year and beyond, our students regularly meet with their faculty mentors, and we will sort of include a leadership coaching aspect to those meetings to provide more structure, which I think the faculty is really going to enjoy, just having certain things to sort of guide conversations. And it'll also help build a little bit more of a relationship around leadership development as well at a more personal level with our students. So we're really looking forward to implementing this program.
Developing a relationship with an executive coach, I learned that coaching and mentorship are different because mentors are typically people who have done the thing you want to do and they're older and they have more experience, but they've had a similar track to what you envision your life to be. But coaches are different because coaches are outside of your field of study and they brainstorm with you and help you develop your critical thinking skills to tackle problems that you haven't done before.
We really had to, I think, lean heavily on the principles and the experience that we've had this year in Fagan. And were it not for the year-long multiple meetings and sessions and discussions that we've had, both amongst ourselves in the group, but also with our individual coaches, and then all of the faculty, Dr. Taylor, Dr. Cook, Dr. Park, everyone who's helped participate on down in terms of helping us become better leaders in our own right. I think were it not for that experience, the curriculum design would have been significantly more difficult. So we were able to take those pieces that we found successful and try to find ways that we can not completely overhaul the already pre-existing primary care leadership track, which has outstanding work, but think about ways that we might be able to help improve it even more.
We wanted to incorporate some elements that we all found really valuable. A few of those things were the leadership development model that Duke Health and Fagan generally structure their curriculum around. We wanted to help that structure be incorporated into the PCLT program. And then we also found other activities really valuable. So we did a values workshop at the beginning of the year that really helped us solidify individually and as a team what our values were personally, professionally, that then informed our individualized leadership coaching. And so we wanted to bring that kind of model into the PCLT curriculum as well.
Throughout my third year being a part of both programs, PCLT and Fagan, I've been able to see how they really complement each other, and that's why I think our updated leadership curriculum for the PCLT program through this project will be really important and valuable for incoming PCLT cohorts in the future.
We hope that through our connection with the PCLT, students can utilize some of the resources that we've created to have confident, educated, and time-managed discussions with their coaches so they can target some of their goals and make them actionable.
In PCLT, we see leadership as a transformative capability that spans healthcare and community engagement. Our unique model provides the space for students to practice and develop leadership skills essential for both contexts. Our leadership coaching program offers personalized guidance to enhance students' leadership in healthcare and community settings, refining their decision-making skills and fostering significant personal and professional growth. Fostering critical thinking and emotional intelligence is crucial. Whether you're leading a community project or managing a clinical team, our curriculum supports deep reflection and strategic problem solving. Effective teamwork is foundational in both healthcare environments and community projects. Our leadership program equips students to excel in collaborative settings, preparing them for future leadership roles. Our program helps you master various leadership styles, essential for navigating complex dynamics in healthcare and community leadership. Building resilience and managing stress are critical for leaders. Our coaching program provides strategies that support well-being in any high-stakes environment, promoting long-term success. Our graduates transition from the classroom to leadership roles in healthcare and community settings, equipped with insights from our coaching to inspire and lead effectively. leadership potential exists in everyone. Together, we can create change agents who will transform healthcare delivery and education through community-engaged collaboration and ethical leadership.